Hello everyone and welcome to this session in which we are going to talk about autopsy procedures. So let's begin the talk about autopsy procedures by primarily understanding four different kind of autopsies. Okay, uh, most of us keep on hearing these four words. One called as medico-legal autopsy. Then there is something called as clinical or pathological or hospital autopsy. Then we hear something called as psychological autopsy. Now, this form of autopsy is very important to remember. And then we also hear something called as virtual autopsy. So, first of all, let's see what are these different forms of autopsy. So, the first one is called as medico-legal autopsy. Medico-legal autopsy is the form of autopsy which is done to know the cause of death, right. So, this is one autopsy which is done to find the cause of death. It is done under CRPC 174 or CRPC 176 provisions in India. We have talked about these provisions in our inaugural chapter of Indian legal system. Then the second form of autopsy is called as clinical or pathological autopsy, right. This is a type of autopsy which is not done to know the cause of death, but it is rather done by a clinician who is probably treating a patient and the patient dies under the treatment, but the clinician is worried because probably the patient didn't respond to treatment or it was a unique novel case, and thus the clinician wants to undertake the autopsy to know what is the pathological reason of death. Okay, so hospital autopsies are done to find any pathology in the dead body. Now, why would a clinician want to do this kind of an autopsy? Because he wants to do a research, he wants to conduct a study, right. So, we can safely say that clinical or pathological form of autopsy is a research oriented situation, right. So, in these two things, there is a very contrasting feature that we see. And what is that contrasting feature? That contrasting feature is in the consent. See, in medico-legal autopsy, the cause of death has to be found because an inquest was going under CRPC 174 or CRPC 176, and the state wants to know the cause of death because the state believes that it could be an unnatural death because of any crime, right. And so, the consent for autopsy comes from state. The consent for autopsy comes from state. For example, if I say that there has been an alleged case of homicide, okay. Now, the state wants to know how the person was killed, right. The state would give consent to the autopsy doctor to conduct the autopsy in this case. The doctor does not have to take that consent from the relatives. That is what we want to say. On the other hand, if you will see the clinical or the pathological autopsy, where a clinician wants to undertake the autopsy to know the pathology in the body, here the clinician has to take the consent from relatives. Okay. Here the consent comes from relatives because the clinician has to counsel the relatives that it is important for the medical science or for his research or for his study purposes that he looks inside the body, and whatever information they can gain, they can use that scientific information for further prevention of death in any other patients. Okay. Third form of autopsy is called as psychological autopsy, yet another very important form to understand. Now, first of the things that we need to remember in psychological autopsy is that when we say psychological autopsy, it is done to recreate the psychology of a person who committed suicide. So, this is one form of autopsy which is reserved for suicidal cases. Remember, this is one form of autopsy which is reserved for suicidal cases. Now, what exactly is this psychological autopsy? Consider a person who commits suicide by hanging himself. Okay, his body is found by the family members, who in turn call the police. The police takes the body and conducts an inquest under CRPC 174, because police would want to remove any doubt in their head that no other foul play is involved, and this eventually is a suicide. Now, inside of that 174 CRPC inquest, the police may subject this dead body for a medico-legal autopsy. Okay, medico-legal autopsy happens in that case where the autopsy surgeon prepares a report stating that the cause of death is hanging asphyxia, and no foul play is seen in this case, and probably it's a case of suicide. So, now it is documented by medico-legal autopsy that it looks to be a suicide. Now, consider if somebody is interested to know why did this person commit suicide, and somebody takes on to recreate the psychological domain of the person who has committed this suicide. This concept is called as psychological autopsy. So, when we say psychological autopsy, actually there is no autopsy happening. It is a process which attempts to recreate the psychological domain of a person who committed suicide. And how this process will be done? This process will be done by taking interviews of the deceased's family members, his friends, his peer group. Okay. So, in a nutshell, if I have to say what is psychological autopsy, psychological autopsy is a process where interviews are held with the family members and friends of the person who committed suicide. The reason for holding those interviews is that the researcher wants to know what was the psychological status of the person who committed suicide, right. So, what is the approach of psychological autopsy? The approach is not opening a dead body, because there is no dead body for it to be opened. The approach is conducting interviews. And who will give consent for those interviews? It is the individual person. It is the individual person. If he wants to be interviewed, if he wants to say something around the death of his near and dear one, he would say. If he does not want, he may not say anything. The fourth autopsy is called as virtual autopsy. Virtual autopsy is done to conduct post-mortem without cutting the body. Okay. And how is this possible? This is possible by radio imaging. So, you take radio imaging help to look into the interior of the body. Thus, there is no cutting of the body. right? And who would give consent for virtual autopsy? It depends why virtual autopsy is done. If it is done for a medico-legal scenario, then the consent shall come from state. If the virtual autopsy technique is used for clinical or pathological autopsy, the consent would come from relatives. So, virtual autopsy is just the autopsy technique, right. So, these are 4 different names of autopsies, and one should know things around these different kind of autopsies. Let us move further and let us now talk about the most common type of autopsy, which is the medico-legal autopsy. Remember, medico-legal autopsy is the autopsy in which the aim is to find the cause of death, right. So, in a medico-legal autopsy, there could be 3 possible outcomes. The first is positive autopsy. What does it mean, positive autopsy? The cause of death is found. So, we wanted to know the cause of death, we conducted the autopsy doer inspected the exterior of the body, and then he opened the body, then he inspected the interior of the body, and he found the cause of death, right. Now, when this kind of inspection of the body is done, the autopsy doer is expected to find the cause of death most likely during the gross examination. What is gross examination? When he inspects the body with the naked eye exteriorly and he inspects the body with the naked eye interiorly, and he finds any trauma or damage inside the body that would have been the reason for the death of a person. For example, a person is stabbed in the abdomen and the autopsy doer opens the abdomen, he finds that there are multiple cuts in the intestine, there are multiple cuts in the liver, and the abdominal aorta also is punctured, due to which there is lot of collection of blood in the abdomen, which means most likely the cause of death has been hemorrhagic shock, right. So, we found the cause of death. This is called as gross examination finding. Now, for example, let us say if the autopsy doer does not find any gross deficit in the body, what should the person do? The next 3 possibilities, if gross findings are not present in the body, is number 1, the person might have died due to any poison in the body, right. Number 2, the person might have died due to any specific vital organ damage in the body, right. And number 3, he might have died of an immunological reason, okay. And so, to rule out these possibilities or to find the death within these 3 reasons, it is very important that if gross findings are not seen in the body, we preserve viscera for chemical analysis to find out any poisoning in the body. If we get any poison in the body, because we need to preserve viscera, the viscera will go to forensic science lab, that will be analyzed, and if any poisonous content is found in the body, the report will come stating that what poison has been seen. So, if we find any poison like that, the cause of death can be attributed to the poisoning. Simultaneously, we need to consider that the poisoning report may come negative. So, what we had done is simultaneously we had also taken histopathological samples of vital organs, because if the viscera report for poisoning comes negative and simultaneously during autopsy we have taken histopathological samples of vital organs, and these vital organs are going to be processed in the histopathological lab, where they can show that some histopathological damage was seen in the vital organs of the body, that was the cause of death, then cause of death again is found and it could be attributed to that histopathological finding. For example, let us say for the argument of course that viscera comes negative, histopathological samples which were taken simultaneously during the autopsy, they also come negative, that is every organ was histopathologically okay. Similarly, simultaneously we had also taken immunological samples. Those immunological samples will also be processed in the serological lab, and if any immunological reason comes as cause of death, even the cause of death now has been found. So, serological findings becomes important. So, what I want to ascertain here is that when we say positive autopsy where the cause of death is found, there are 4 areas that can deliver the cause of death. You can see all those 4 areas. Number 1 is gross examination, number 2 gross examination negative but poison positive, or number 3 gross examination negative, poison negative, histopathological finding positive, or number 4 gross examination negative, poison negative, histopathological finding negative, but serological finding positive. In any way we got the cause of death, and this is called as positive autopsy. Now, what if we do not get cause of death? So, in spite of doing all the 4 processes, if we do not get cause of death, that concept is called as negative autopsy, where cause of death is not found. Now, for a negative autopsy to be truly negative, we have to rule out 4 possibilities. And what are those 4 possibilities? What are the areas to be ruled out before labeling the autopsy as negative autopsy? We have seen those 4 possibilities earlier also. The first is no gross finding. The second is negative toxicological report. The third is negative histopathological report, and the fourth is negative serological report. So, if everything comes negative, the autopsy is said to be negative autopsy. Remember, of all the medico legal autopsies, true negatives are 5%. So, of all the autopsies those are conducted, the medico legal autopsies to know the cause of death, true negatives are close to 5%. Then third outcome of the medical autopsy could be what is called as obscure autopsy. What is an obscure autopsy? Where the cause of death is found, but it is not significant to kill everyone. Let us see what are we saying. What I am saying is cause of death is found, but the findings are minimal. These findings are responsible for the death of that particular individual, but not sufficient to cause death ordinarily in everyone. So, what am I saying? Consider we are doing an autopsy and the interior of the body is clean, the exterior of the body was also clean. So, no particular organ damage or trauma has been found in the interior of the body to say that the cause of death is definitely a particular finding in gross examination. But when we are dissecting the heart, we see that there is an 80% block in the coronary artery or one of the coronary arteries. Now, this could have been the reason for death in this particular individual, he might have died of myocardial infarction due to the coronary artery disease and subsequent blockage of the coronary artery. But there are so many people who may develop 80% blockage of the coronary artery and they never have myocardial infarction in their lives, because by the time that blockage happens, simultaneously collateral circulation develops very well and they keep on living till their end of life and they never have MI, which means an isolated finding of 80% coronary artery blockage, is it sufficient to kill everyone if it is present in number of people? The answer is no. This isolated finding is not sufficient to kill everyone, but it may be the cause of death in one particular individual. If only these kind of findings are seen in a person, this is called as obscure finding, and if only obscure finding is seen in a dead body, the autopsy is called as an obscure autopsy. Remember, when we talk about obscure finding, cardiovascular system is the leading system in obscure findings, right? Cardiovascular system is the leading system in obscure findings. Let's move further and let's now have some common knowledge around autopsy. The first thing is to understand that routine autopsies involve mandatory opening of 4 body cavities. So, whenever we are doing autopsy for any reason, the person may have been found dead on the roadside, the person might have sustained burns and then might have died under treatment in the hospital. A person may have been found hanging in his room, or a person's dead body might have been found on a construction site where it looks that he might have been stabbed multiple times on the body. Whatever reason, road traffic accident, a person is dead, whatever reason, when we are doing a medico-legal autopsies, it involves mandatory opening of 4 body cavities. These cavities are head, neck, chest and abdomen. In routine autopsy, there is no requirement of opening any special structure like spinal cord, right? There is no special requirement of opening any other special structure. What is to be opened? Head, neck, chest and abdomen, right? So, a lot of times it has been asked in the questions very previously that spinal cord, if it is opened in routine autopsies, the answer is no. But what if there is an indication to open the spinal cord, right? Because spinal cord is opened only if an indication. And what could be the indication of opening spinal cord? You can say one very important reason could be a bullet can be lodged. If there is a person who is being shot and the bullet has gone and hit the vertebral column and lodged inside the spinal cord, or there is a spinal injury, it could be a case of spinal concussion or any other spinal trauma that might have sustained by the person. So, if there is a special indication for opening of the spinal cord, then only spinal cord is opened. Now, the question is, if the spinal cord has to be opened, what is the best route? The best route to open spinal cord is posterior. the best route to open spinal cord is posterior approach, right. Also, we need to understand a very important thumb rule when we talk about basic concepts of autopsy. And what is that? What is the first body cavity to be opened in autopsy? Now, understand two basic thumb rules. The one is, open the cavity first where the cause of death is expected. So, if we are inspecting a dead body exteriorly and we know that there is a bullet penetration in the chest, then open the chest first. If we are inspecting the body exteriorly and we can see that there are multiple stab injuries in the abdomen, then open the abdomen primarily or first, because that is where we are expecting the cause of death to be found. So, this is the basic thumb rule, but it has an exception. The exception is neck or head. So, if we are inspecting a dead body where we know that there is a ligature mark in the neck, so somebody has compressed the neck, it could be a case of hanging or it could be a case of strangulation. So, we know that the cause of death has to be found in neck, but still do not open the neck first. If it is a case of head injury where we can see there is certain laceration in the head, and when we are going to open the head, we may find bleeding in the cranial cavity. So, cause of death will be found in the head. Still, do not open the head first. So, the basic thumb rule is, open the cavity where we are expecting to find the cause of death, but the exception are neck and head. Even if the cause of death is present in neck and head, they should not be opened first. Okay. And the second exception is, or the second thumb rule is, when cause of death is not known. So, what if the body exteriorly is clean? So, after outer inspection we do not know where we are going to find the cause of death. In that case, open head first. In that case, open head first. So, this is something that is very, very important, because question can be generated around this area. To simplify what I have said in these two lines, let us understand this table. This table says sequence of body opening in different situations. Let us say what happens in trauma cases. If there is a trauma in the abdomen, which means we are expecting to find the cause of death in abdomen, what is the first cavity that we open? It should be abdomen first, right? If the cause of death is in the chest, what should be the first cavity that should be opened? Chest first. But if the cause of death is expected to be in the cases of neck, like in cases of asphyxia, then we open neck not first but last. And same, what if the cause of death is in the head? We open head last. Why do we open head and neck last? Because if we are expecting the cause of death to be in the neck or the head, we want bloodless fields when we open these structures. So, what do? We open the thorax and the abdomen first. If we are opening the neck, we open the thorax and the abdomen, then we open the head and we open the neck last. So, relatively whatever is in the neck, it becomes bloodless. Okay. Similarly, if you think that the cause of death is in the head, we open the thorax and the abdomen, then we open the neck. So, whatever blood is present in the cranial vessels, it drains out. Now, the cranial cavity is relatively bloodless. We want bloodless field. Okay. What if the case is not of trauma, the case is of maybe poisoning, or it could be a natural death, or it may be an infant dead body. Now, what is common in all these three situations is that in case of poisoning, the exterior of the body will be clean. In cases of natural death, somebody had an MI and died, the exterior is expected to be clean. And so is in the cases of an infant dead body. The exterior may not harbor any injury. And what we have learnt from the basic thumb rule, that when we don't know where the cause of death is, what do we open first? We open head. So, you open head first in all these situations, right? And this has to be followed by the other cavities. So, after opening head first in the cases of poisoning, then you open chest, abdomen and neck. Similarly, in cases of natural death, once you have opened the head first, then you open chest, abdomen, then neck, right? Try to open neck last anyhow. But in cases of infant autopsy, there is one very important precaution that we need to take. And what is that precaution? That after opening the head, to rule out any neural defects that would have been anyhow incompatible with life. So, if there are no neural defects and we know that the cause of death in the infant autopsy is not any intrauterine death due to neurological damage, we need to see whether it is live birth or not, right? We need to see whether it was live birth or not. And for that reason, before opening chest, we have to open abdomen. So, we have to open abdomen first, followed by chest and neck. So, very important precaution that we need to take here. Very important. In fact, it has been asked in examinations, it has been asked in INI-CET examination in 2024 also, that what is the sequence of body cavity opening in cases of an infant autopsy. It would be head, followed by abdomen, followed by chest and then neck. So, abdomen in infant is opened before chest. We will talk about this reason and the concept more when we talk infanticide, right, in a separate session. So, remember, this is a very important thing to be followed. Let us move on, and now let us talk about some basic body opening incision. So, when we are talking about doing an autopsy, conducting an autopsy, what are the important exterior incisions that we give on the body? The first incision is called as an I-shaped incision, where a line goes from chin to pubic symphysis. Okay. A straight line, thus dividing the neck, the chest and the thorax into symmetrical cavities. Okay. The second is called as a Y-shaped incision, where again we have a primary eye which goes straight, but this time not from the chin, but from the xiphoid process till pubic symphysis. So, it goes from xiphoid to pubic symphysis, and then we have curvilinear incisions going towards the axilla. Okay. The approach, that is a Y-shaped approach, is more better for breast pathologies. So, if you want to inspect the breast tissue better, a Y-shaped approach is better. And the third one is what is called as a modified Y. Again, it contains a basic eye which now runs from sternal angle till pubic symphysis. So, we have now a straight line running from sternal angle till pubic symphysis, and then two oblique incisions going from the sternal angle towards mastoid. Right, thus creating a Y around the neck. This incision is, that is, modified Y shaped incision. This is best for neck dissection. So, somebody asks you that there is a case of hanging or there is a case of strangulation, right, a kind of asphyxial death. What would be the best external incision to be given on the body? The answer should be modified Y, best for asphyxial death. So, remember, modified Y is best for asphyxial deaths or neck compression cases, right. Now, let us move forward and talk about once we have opened the body and now we are into the body cavities, right. How do we take the viscera out? This is called as evisceration. So, what are important evisceration techniques? So, when we talk about evisceration techniques, we talk about 4 procedures. The first one is called as Virchow's technique. The first one is called as Virchow's technique. In Virchow, there is individual organ removal. So, whatever is the organ of interest, you cut that organ from its attachment. You take that out, you wash that organ, you dissect that organ, you inspect that organ, you put it back, and now you cut out the next organ of interest. So, you take out organs from the body one by one. That is called as a Virchow's technique. Okay. Second is Rokitansky. Rokitansky. What is Rokitansky? The organ dissection is done in situ, which means the organ is not cut and taken out from the body cavity. The reason for conducting Rokitansky would be to minimize blood or fluid spillage in infected bodies like hepatitis or HIV or coronavirus death. So, Rokitansky is employed to minimize any kind of droplet or aerosol spillage to prevent the autopsy doer and his staff from acquiring those infections, right. So, in cases of HIV body, in cases of hepatitis, in cases of coronavirus death, this approach would be preferable. Third approach is called as Letule. Third approach is called as Letule. Letule is en masse dissection and organ separation. So, when we say en masse, what does it mean? It means from tongue to anus, everything is dissected out of the body as a single mass. Nothing is separated away. Now, when we talk about tongue to anus, you will find that it comprises of 4 different body units. These are also called as 4 different trunks. So, when we talk about letule, you will see that letule will have 4 different trunks. The first one is oro cervical trunk. The second one is cardio pulmonary trunk. The third would be gastrointestinal trunk, and the fourth would be genito urinary trunk. When all these 4 trunks are taken out of the body, connected together with each other, so all the anatomy is maintained. This is called as letule. And the fourth one is called as Ghon's technique, which is also called as separate block dissection and organ separation. Now, what happens in Ghon's, which is called as separate block, also known as en bloc organ dissection technique. Here, like letule, everything is not connected, but the 4 trunks are taken out separately. So, in Ghon, we will have oro cervical, that will be separate. We will have cardio pulmonary separate. We will have gastrointestinal trunk separate, and we will have genito urinary trunk separate. So, within the trunk, whatever organs are there, their relevant anatomy is maintained, but intertruncal anatomy is lost. This is called as Ghon's technique of organ dissection. Okay, let's move further, and now let's talk about head opening. Okay, so how do we open head? So, when we talk about adults, the head opening involves 2 steps. The first is opening of the scalp, first, followed by opening of the calvaria. that is the bone. So, scalp is opened by giving a coronal incision from one mastoid to another behind the ear. So, you give a coronal incision behind the ear from one mastoid to another and then reflect the flaps of the scalp anteriorly and posteriorly, thus exhibiting or opening the uh, skull cap. And then once you have opened the skull cap, once you have reflected the skull cap, you give circular cut all around the skull cap, so that you can lift off the top of the skull cap and then you have an open head available, and you proceed into the dissection by now cutting the dura away. But in cases of infants, the skull bone is still cartilaginous. So, once you have reflected the scalp away, there are two different techniques of opening the infant head. The one technique that we know is called as Bennett's technique, where let us say you have a skull like this, where you have the anterior fontanelle and the lambda, right. So, in Bennett's technique, what do? We start to give a longitudinal incision like this 5 millimeter away from the sagittal suture. We continue the incisions into the frontal bone area and the incision is then curved downwards. Similarly, in the posterior parietal area, the incision is curved downwards, and the same thing is done on the other side also, right. So, this incision is given five centimeter parallel, not 5 centimeter, 5 millimeter parallel to sagittal suture on either side, right. And when you curve those incisions downwards, thus you create two opening flaps. This two opening flap technique is called as Bennett's technique. So, remember, this will also be called as two skull flap technique. Two skull flap technique. The other one is called as bars technique. What do we do in bars technique? Is we have the infant skull, right? Again, we start to build a cutting 5 millimeter adjacent to the sagittal suture, but we curve down without crossing the anterior fontanelle, and we cut down posteriorly also. Similarly, we do on the other side, right? And the anterior segment of the skull, which still remains unopened, we do the same thing there also. So, we begin if incision going from anterior fontanelle towards the front, and we curve down on both the sides, that is around the anterior fontanelle and at the beginning of anterior fontanelle like this, and at the front of the frontal approach. So, this creates 4 skull flaps. This is called as 4 skull flaps technique that we see in bars. So, there are 2 ways of opening infant skull, the Bennett's technique and the bars technique. Okay. There is very special, something very special about the stomach opening also. What we need to know in stomach opening is a special track called as root of Magentras. See, when we talk about the stomach and we see the cardiac end and the opposite end of the stomach. From the beginning of the cardiac end here along the lesser curvature till the pyloric end, the mucosal folds, they run longitudinally like this, right, whereas in the remaining portion they may have this kind of transverse presentation. This longitudinal running of the mucosal fold is called as root of Magentras, and the medico legal importance of this root is liquids quickly run to the pyloric end through this route, and the same shall happen in cases of corrosive ingestion, right. We are expecting the corrosives to take this route around the lesser curvature to reach the pylorus and many other poisonous substances also, and that is why the dissection of stomach is done by cutting the stomach wall along the greater curvature of stomach, not the lesser curvature. The reason is to preserve the root of mesenteries, right. So, this precaution has to be taken in cases of stomach dissection. Okay, let us now talk about preservation of viscera. We have already talked about it earlier that whenever there is a confusion that cause of death is not apparent in the gross finding, we preserve viscera to rule out poisoning. So, when we say we preserve viscera, what exactly do we preserve? See, when we say we preserve viscera, we preserve three important pathways of body. The first pathway is the ingestry pathway, the pathway which is used to ingest something or to introduce something inside the body. That pathway is preserved separately in jar 1, and the representation of that pathway is stomach with all its contents. So, whatever is present in the stomach and portion of small intestine. So, this represents the ingestion, right. The second thing that happens after ingestion is that whatever has arrived in the stomach, it will be taken into the absorption, and once it is absorbed from stomach and intestines, it will be circulated in the body. So, the second thing that we need to preserve is the circulatory pathway. We preserve circulatory pathway separately in bottle number 2, and the circulatory pathway is blood. So, the second preservation that happens is of circulatory or distributory pathway. Then what will happen? Whatever has been distributed or circulated in the body, that will eventually be excreted out from the body, right. So, the third pathway that we need to preserve is the excretory pathway. So, now we preserve excretory pathway in a separate jar, that is jar number 3. It comprises of complete spleen, portion of liver containing gallbladder, and longitudinal half of each kidney. This represents the elimination from the body or the excretion from body. So, let us label it as eliminatory pathway, right. There is one more product which represents the eliminatory pathway, and that is urine itself, but it can only be collected if at the time of death or after the time of death, when we are doing autopsy, the bladder is full with urine. If the urine is present in the bladder, we can inject out the urine from the bladder, and we preserve urine in a separate bottle, right. It also represents the same eliminatory pathway, right. So, these are three pathways with their representation by various organs and products or fluids of the body, which are sealed and packed, or I should say packed and sealed, when we say we preserve viscera. So, what do we see in viscera preservation, which is done to detect any presence of poison in the body? You can see that there is no specific vital organ preservation that is necessary. So, when we say viscera for detection of poison in the body, there is no necessity of preserving any heart, any lung or any brain, right. What we need to preserve is ingestory pathway, distributary or circulatory pathway, and third is eliminatory pathway, right. And apart from preserving all these pathways separately in 4 separate jars or bottles, or a combination of jars or bottles that we have just seen, we also have to preserve what is called as a sample of preservative in bottle number 5. So, whatever preservative that we are adding in those jars and bottles for preservation, a sample of it has to be added, because this serves as control solution. So, you are already documenting that this solution is being added by yourself. So, when we see preservation of viscera, these are the structures or samples which are preserved. Now, when we say that report of viscera examination will come, the report will also come accordingly. Let us say a report comes, how do we interpret that report? Okay. Let us say the report comes and it says certain poison was found in jar number 1 only. Now, it is a highly unlikely situation. Why? Because if the report says that certain poison was found only in jar number 1, jar number 1, if you recall, was the ingestory pathway. So, whatever has been found, it was ingested, but it never got absorbed, because it is only found in jar number 1. But for theoretical reason, what would be the interpretation of this finding? Only consumption but no absorption of poison. Now, this is highly unlikely. Normally, this kind of report should not come. What if the report says that whatever has been found in jar number 2, which means the product was in active circulation at that time, which means the death has happened due to acute poisoning of that product, whatever has been found. And what if the report says no product in jar number 1, that is no product in ingestory pathway, no product in jar number 2, so nothing was in active circulation also, but only in jar number 3, which means whatever was probably ingested, it was circulated, distributed, metabolized, and now is being excreted from the body. So, that is why we just found the product in the eliminatory pathway, which means the person survived the acute poisoning by the product and he died due to delayed complication of that poisoning, right. And that is why the poison was only seen in the eliminatory pathway jar. So, depending upon how the report comes, the interpretation also changes, and that is why we preserve everything separately into separate jars, right. Now, what are some common preservatives those are used in this preservation, because these are all organic structures. So, if you are not going to add any preservative into it, they will decompose while being sent from the dissection room of the autopsy to the police, and then police taking those samples to the forensic science lab, where they will be kept for a while, and when the time of their analysis comes, if no preservative is being added into it, they may get destroyed. So, let us see what are the common preservatives. The first is, if you are preserving viscera for toxicology, the preservative which is commonly added is saturated solution of common salt. Now, this thing is being asked in examination sometimes, that what is the preservative which is being used for preservation of viscera, and many a times student does not know the answer. So, they mark it wrongly as 10% formalin. 10% formalin is the best preservative for human tissues, but for viscera the organs are not preserved in 10% formalin, right. The preservative is saturated solution of common salt. But there is an exception. The exception is in cases of sulfuric acid poisoning, the preservative is rectified spirit. Okay, the preservative is rectified spirit. In cases of histopathological tissues being preserved in the autopsy, the preservative now is 10% formalin. In cases of blood and vitreous humor, the blood which is preserved along with the viscera, right, or even if the blood is preserved separately along with vitreous humor, because vitreous humor just like blood is a very effective sample for estimation of alcohol in the body. The levels of alcohol in blood and vitreous humor are almost parallel, right. Both of them are preserved in sodium fluoride. The reason for adding sodium fluoride here is to inhibit enolase, right, a glycolytic enzyme. If you do not inhibit enolase, the blood cells will keep on utilizing the alcohol present in the blood and keep on doing their glycolysis. So, by the time you have taken the blood, till the time the blood will be analyzed, certain level of the content of blood will be decreased, which you do not want. So, you want enolase inhibition, so you add sodium fluoride to it. Then urine can be preserved by adding HCl, sodium fluoride, thymol or toluene. Okay. Out of the four, toluene is said to be the best one. Okay. Then injection prick site, any injection prick site present on the body, or you are taking any biopsy tissue from the skin sample or any other surface of the body, you preserve it in normal saline like any other biopsy material is preserved. And if you are taking swabs for virological cultures from any of the cavities or spaces of the body, you preserve it in 50% glycerol. So, these are certain chemicals and substances, utilizing those chemicals for their preservation, which are commonly used in the dissection hall of the autopsy room on day-to-day basis. Like with that, we come to the end of this section. I will see you in the next one. Keep on revising well.